Now, for this question, students were asked to talk about a type of rhabdomyosarcoma. Now, this is what is known as the pleomorphic rhabdomyosarcoma. Okay, so you're just asked to discuss pleomorphic rhabdomyosarcoma. Okay, and I have all the pictures here, which will help you guys comprehend better. So here, how I discussed this is I went to the definition, I spoke about the epidemiology, I spoke about the clinical features, then I went to the pathology, the microscopy, the immunohistochemistry, the prognosis and treatment. Right, so let's quickly run through it. Most of these pathologies are boring, I know. Okay, they are also boring for me. Okay, so it's actually rare. That's pleomorphic rhabdomyosarcoma. Is rare. Is an aggressive malignant tumor of skeletal muscle differentiation. Okay, so it's actually one of the histological subtypes of rhabdomyosarcoma. If we're talking about the general rhabdomyosarcoma, this one is like a type. So definition is a high-grade sarcoma. It's composed of bizarre pleomorphic cells. They show skeletal muscle differentiation. Okay, so they is considered the adult form of rhabdomyosarcoma. Yeah, so you actually got it. Okay, so it's different from the embryonal type of rhabdomyosarcoma and the alveolar types of rhabdomyosarcoma. That one usually occurs in children. Okay, so epidemiology is mostly in adults that are more than 40 years. Sex, mostly in men. Okay, women will suffer for a lot of things. So sites, usually deep tissues in the thigh, in the arm, in the trunk. Okay, then it's rare. Okay, so among all the rhabdomyosarcomas, this one is just like 5%. Okay, now I have the pictures here, everything. Okay, so clinical features is often deep-seated and large. Okay, when you try to diagnose it, may cause compression symptoms. Okay, depending on the location, you might actually compress some other surrounding tissues. Do you understand? That's what we mean. So pathology, gross. If you look at gross, like if they dissect it out, it's usually large, it's fleshy, it's infiltrative. If you go down the microscope, which I have all the microscope views here, okay, you see that there's marked cellular pleomorphism. You see bizarre giant cells and spindle cells. There's abundant eosinophilic cytoplasm. Okay, there's cross striations might be seen. So resembles undifferentiated pleomorphic sarcoma. So immunohistochemistry is positive for things like desmin, myogenin. Okay, so that's just what we got. So prognosis is highly aggressive. So there's poor outcome. People that have this type of rhabdomyosarcoma, they will rarely recover from it. So it tends to recur locally. Okay, like our treating is coming back. Okay, and survival rate is just 5 years. So treatments, you can surgically excise it. Okay, so also radiotherapy, chemotherapies, and all of that. Okay, so that's what we got for pleomorphic.